Health isn't expensive, it's priceless. Safety is not a state, but a state of mind. With that being said, a warm and wonderful evening to one and all present here, and I'd like to welcome you all and our expert speaker of the day, Dr. Shivaraman sir, senior orthopedic consultant from Apollo Hospital, our very own senior consultants, our management makers, and all the working pillars of our organization to this World Day of Safety and Health at Work. Today's event will be an opportunity for us to learn and share practices at work and highlight its importance of maintaining positive health culture. I hope this event will inspire and motivate us to work towards creating safer and healthier workplace for all. Now I welcome senior optometrist Ms. Janani to introduce our guest speaker of the day.
Good evening and welcoming you all once again. And today on the World Day of Health and Safety at Work, we Department of Occupational Optometry Services have uh, planned for a guest lecture on one of the leading occupational morbidity, the work-related musculoskeletal disorder. While there are good number of studies reporting MSDs in various occupational setup, we thought we should understand where we, the employees of HASN, stand in this situation. So we did construct a survey and quickly shared it among our employee. And yeah. So thanks for your time. We got around 181 responses in last 2 days. And of these, when we try to understand our nature of task and then how do we go about performing these tasks, like majority of the task is we do do in mixed position, like we sit, stand, and bend, and etc. And when they try to understand like what is the type of a task it is involved in, like we do most of our task involves a repetitive pattern, like we're constantly typing, moving, scrolling, and etc. And we also did you people also did report that you constantly feel there is a frequent adaptation to the correct posture, or you keep changing your posture so that you feel comfortable. 32% of us have observed it and reported this. And when trying to understand, and with regards to it, like majority of the symptoms reported was the lower back pain, followed by the neck and shoulder pain. And I'm trying to understand, like when was the symptoms you feel, or you reported was like at the midday of the shift, followed by the at the end of the shift. And of these things, like it was happy to see, like at least 60% of the of us were involved in one of the this recreational activities, like walking, jogging, or yoga, and etc. And also trying to understand, like if we were aware about the workplace ergonomics, and yeah, sorry, some like about 60% of us did report we were aware of it, but we still report one of these symptoms while at work. And about 37 for 20% of us did visit hospitals for the to relieve the for the relief of the symptoms. And about 11 of you did feel comfortable after the visit. And with these situations and the results from the survey, so we and our previous experience from listening to doctor in one of the IOH session, we thought he'd be the right person to address this situation. So welcoming Dr. Shivaraman, was a fellowship trained in shoulder and elbow surgeon, who has extensive experience in management of shoulder and elbow problems in UK and India. He has worked as a shoulder and elbow consultant in Doncaster and the Bestell Teaching Hospital in NHS Foundation Trust in UK, and in Corporate Teaching Hospital in Chennai. With 13 years of his experience at National Health Services in UK, Dr. Shivaraman has proved to be an expert in shoulder, elbow, and complex trauma surgery, delivering high quality of care through his evidence-based practice. Currently, he is working in Main Apollo Hospital as a senior orthopedic consultant with a special interest in shoulder and elbow. His practice involves all aspects of shoulder and elbow, as elbow care, like arthroscopy, joint replacement, and trauma. Is specialized in upper limb joint replacement, like short-term shoulder replacement, resurfacing of shoulder, total shoulder replacement, reverse shoulder replacement, and total elbow replacement. It gives good result in complex upper limb surfaces, like fractures like scapula fracture, proximal humeral fractures and IAC joint dislocation. With all these merits and experiences, I feel honored to welcome Dr. Shivaraman to share his knowledge and make us aware of about all the workplace MSTs and make us feel the workplace a better. Thank you. Over to you, sir. Yes. Yeah.
Hello, good afternoon, all. I want this as a discussion rather than just the slides and teaching. It's probably like a practical thing. Like when you have any problems, you can stop and ask me anytime. Okay, it's like this teaching is mainly like not teaching it. It just gives the experience of how to prevent, because we have all healthcare workers. We don't take care of ourselves. We just give the patient priority first, but we need to take care of ourselves as well. Okay, it's just we see what are the orthopedic problems can happen in the healthcare our professionals. Is mainly we've seen that in your survey as well, most of you had the back problem, neck problem and shoulder problems. Other problems are like happen from head to toe, like carpal tunnels, tennis elbow problem, heel pain, knee pain, and the tingling sensation in the legs and arms can happen as well. We going to see what are the correct technique to use when you're shifting the patient or lifting weights, and when using the computers, what's the posture, and the correct equipments to use whenever necessary, and the stretching exercises to prevent, because even though we're doing the correct technique and things, if you're having a muscle weakness, the joint will be strained for you, because like the neck problems, the back problem happens because you're not strengthening your muscles. If not having enough strength in your neck and back, then you get the problems of a neck pain and back pain. All the joint pains as will happen if the muscles of the joint is not strong. What happens is the strain going through the joint is more. Therefore, the more wear and tear will happen. Therefore, you get more arthritis in future. And vitamin D and B12. This is one of the common problems as well. People get the muscle pain and the back pains. Adequate hydration. Just if you want to take 1 point or 2 points, mainly the hydration is main important factor, because it's we got a disc which is like at the back. We got a spinal problem, is a disc problem there. Disc is mainly water. 75% of the disc is water. If you take adequate water, it behaves like a rubber. When you bend the rubber, it comes back to normal posture. When you don't take water, it dehydrated behaves like a plastic. What happens when you bend plastic? You get a disc prolapse can happen. Therefore, adequate water. If you're having no a heart problem or a kidney problem, you can take minimum 3 liters of water per day is fine. If you're having heart or a kidney problem, consult your doctor and then take like adequate hydration. Otherwise, you take minimum 3 liters, we say, for the to prevent the dehydration. But also, people get the pain in the back of the head as well. Towards the end of the day, get the neck pain and back pain, back of the head. That is commonly due to dehydration as well. If you have adequate water, then you can prevent it. And ergonomics, we'll see how to the ergonomics one. Adequate rest. You need to give adequate rest to restore yourself back. The correct technique in this one, if we see that it's probably, I don't know that in multi-specialty hospitals we tend to shift the patients here. Most of them are daycare patients, or it's like not sure. Most of them daycare, they can transfer themselves or something like maybe using wheelchairs. But when you're shifting the patient, like use like adequate number of persons, it's like maybe 2 may not be enough here. You need 3 or 4 people to shift the patients adequately with the help of the slide, that you can use the board as well to slide the patients for you protect your back, because if you lean forward too much and pull the weight or something, you can get the back problem. Therefore, you need to make sure that you adequately enough staff, the adequate equipments to be used. As if you see here, this is what I was just saying about the first picture showing that it's like the patient is shifting. If they are leaning forward here, if you're having too much problem, the last one you can see, if you need to lean forward too much, they can get onto the bed and shift the patient like that. If you lean too much, then what happens is you get the back problem can happen. And this is a important slide for those using computers. I think most of us use computers nowadays, either in work or at home or anything. But for the those who are in computers, they use for a long time. Like those job involves the IT job or secretaries, they use the computers all the day long. What happens is if they when they start, they will start like this. The posture is fine, the height. The was what we normally recommend is the eye should be at the level of the upper part of the monitor. And also having a back support chair. The chair should be having a adjustable height. Therefore, your foot is rested on the ground. If your foot is not rested on the ground, what happens? You get a compression here in the just in the lower part of the thigh, then can cause a blood clots like a DVTs can happen, or you can get tingling sensation because of nerve compression. Therefore, you should actually not hang the leg down if you're working for a long time. You have some support in the foot here, or you can adjust the table height or the chair height to just to rest the foot on the floor. And you should not extend the arm too much. Like if you're doing the computers like this, you can get a strain in the shoulders and things. If you have a just adequate rest like this, the resting the wrist, the wrist should be of adequate length. If you're using the wrist in a awkward posture, like a tilting towards the right or left or more extended, if you get the more extension, you can get the carpal tunnel features like a tingling sensation in the fingers. If you're using the wrist more towards the one side, you can get the problems like a decurrence problem, the tendinosynovitis, or ulnar side problems can happen. Therefore, when you're using the computer for about 10 minutes, 15 minutes, doesn't matter, like it will all correct itself. But when using for a long time, like 6 to 8 hours a day or something, you should make sure that you correct your postures, everything. Otherwise, you get, as we say, that repetitive strain injuries can happen. Therefore, when you're having the workstation should be assessed by the ergonomic people, make sure that is of the height and keyboards as well as the mouse position, everything should be correct. You're not straining too much at long time. That's because if you're not resting the arm, if you're keeping the arm not rested, what happens? You get the trapezial pain, neck pain can happen, and shoulder pain can happen. And also this posture, if you start of the day, this posture is fine. But when you start, like say for example, after half an hour, 1 hour during the work concentration, you lean forward too much. You won't understand that you're doing the wrong posture at the time. What you do is you need to set alarm like every hour or something, and get up and then just stretch yourself, take adequate water, and then go to the correct posture again. Because we do that one, you can, because otherwise you work for 8 hours, you're probably working like a first hour you're fine, second hour onwards you just lean forward and then posture will be adjusted at the time. So you need to make sure that adjust it after taking break every time, every 1 hour or 2 hours. You can just put alarm. Just we advise to the IT people mainly, just a posture correction is the main thing that affect them, because during the work from home, what happens is many people not got ergonomic chairs and stools and anything. They ended up having a lot of back pain and neck pain. I think after a year of the COVID situation, then all of them got the chairs and everything being bought, and then they just working in the home now as well. They got all the ergonomic chairs, but still some people, if you're having ergonomic setup at home as well, they still work at their home in bed and things. That can cause problems. Neck pain, back pain can happen. Okay, the correct technique, and this is what if lifting weight, I've seen in the survey that about 5% of people do the manual job. Like in that one, if you just see that when you're using a correct equipment, like if you're having like shifting files or something, if you have a trolley, it's better to use a trolley rather than taking when you're in your hand and things. Just take in a better trolley in a height, adjustable height and things. And when you're taking the weight, you should not bend the back like this. You should bend the hips and knees. That won't put any pressure on the back for you. If you see here, the back is not bent here. If you bend the back, you can get a disc prolapse can happen. Therefore, when you are lifting weights and things, we tell them to hips and knees, bend the hips and knees rather than the back. This is a correct way of lifting the weight rather than just this position. As I told you before, like if you hang the leg down for a long time, you get the pressure here. It can directly leads to the blood clots or a nerve compression can happen. This is a back support. When you all start, it will be like you all start with the back support like this. But over the period of time, what happens is you actually go to the front like this slowly, like a vulture neck position causes a neck problem and back problem. Therefore, you should take alarm or something just every hour and then adjust your posture. Wrist I was talking about, like using the tilt. Don't use the wrist like this towards one side. You can put the pressure on this one. Is like you can get tenosynovitis here, which is called decurrence disease. And if you're getting the pain on the ulnar side, you can get ulnar side pain. You use the wrist like this, straight position, not too much tilted. This can cause the carpal tunnel problems. Okay, these ones, compression of the nerves can happen. And also when using the mouse and computer in a correct direction, should be in a correct direction rather than just this is a correct posture. If you see in this one, the wrist is tilted towards the radial side, that means on the thumb side, and this wrist is tilted towards the outside. this is like they are not having any back support or neck support. Therefore, this person using like a vulture neck. This can lead to the back problem and neck problems. Neck pain. I think I've seen that second most common problem is the neck pain. Most of you, it's when the patient comes with the neck problem, what I'll ask them is if the pain is only in the neck or is it radiating down to the arm? If we'll ask some questions like a red flag signs, like if you're having the symptoms of nerve compression, that means any tingling sensation in the fingers or a pain radiating down to the arm. Some patients say the tingling they can get with the fingers or pain coming up to the arm. Or it can be the problem of urinary motion problem. That means they may having a nerve compression in the spinal cord itself that can cause urinary motion incontinence can happen. Any loss of weight or appetite. If these features are not there, only the just neck pain, we give them a physiotherapy first, and then that will relieve the pain, and then we ask them to do the exercises, neck exercises to prevent the pain coming back. We give them a supplements if they're not taken in the last 2 years, or check the levels and then give vitamin D or B12. We ask them to take adequate water. If they're having any symptoms like what I described, like pain radiating down to the arm, or pain like tingling sensation in the fingers, or a loss of weight or appetite, because loss of weight or appetite means they may be having some infection or a tumor. We need to rule out those conditions. That's why we say them. We need MRI scan those situations. Any urinary motion problem, nerve compression problem, we ask them to get MRI straight away, and then we see them and give the treatment accordingly. Otherwise, just a neck pain alone, we ask them to correct the posture things for IT people. After that, the water and exercises after the physiotherapy. If it is not settling with the physio, then I'll ask them to go for an MRI scan. After 5 days of physio, if not settles the neck pain, then we'll ask them for physiotherapy. They're not had any red flag signs before. We tell them to do exercises to prevent it coming back. Usually about 90 to 90% of people relieve with the physiotherapy alone. And then we tell them to exercises. As I told you, the water is essential. This is a picture showing that water is about 70% of disc is water. If you take water, it behaves like a rubber. If you don't take water, it behaves like a plastic. That means when you bend and strain much, then you have a disc prolapse can happen. Which if it leads to the nerve compression, it may lead to surgery. Like sometimes it may not settle with physio. Then if you have any nerve compression causing problems, you've not even settled after the physio or medicines, then you might need a surgery. Therefore, to prevent it, better to do the exercises. Therefore, the muscle will take the load for you. Instead of going to the spine, muscle will take the load for you. This exercise, I'll ask them to do it like a neck strengthening exercises. It's stretch the muscles and then strengthen the front, side and the back. Like you need to exert a pressure. Therefore, this muscle will be strengthened as this side, this one on this side. Like all the muscles, neck, front and back muscles strengthen. If we hold it for 10 seconds for 5 times a day, then that will give the muscle will be more strengthened for you. We advise for the patients who are having neck pain, we told them not to lift heavy weight until this settles, and also not to ride two-wheelers. Because a two-wheeler, when you ride it, the strain goes directly to the neck. Therefore, we tell them not to ride two-wheeler and the lifting weights until this settles. Once it settles, do exercise and you can carry on as normal. This exercise is mainly for the neck problems to prevent it coming back. When you're having severe pain, don't do this exercise, which will increase the pain for you. Do the exercise when you're having the pain relief with the treatment. Next problem is like a shoulder problem. The most common shoulder problem in younger people is the impingement. And the next one is like the frozen shoulder. Okay, the impingement, what it means is like when you lift the arm up, you have the pain in the middle of the range, mid-range or above the head activity. Like when you reach the top of the shelf or something, you have some pain in the shoulder. Sometimes these overlaps, like a neck problem can cause shoulder problems. Shoulder won't cause much neck problem, but referred pain can happen from the neck to the shoulders. The nerve compression can cause the shoulder pain as well. But when we examine the patient, we ask them to move the neck first. When the shoulder examination, I'll ask the patient to move the neck. When they're moving the neck, if they're having pain coming down the arm, that means it's coming from the neck. If they're moving the shoulder when the pain is there, then that means they're having shoulder problem as well. It is not uncommon to have both the problems together, neck as well as shoulder problems. The shoulder problem, most common problem in the younger people is the impingement. What that is, it's you're having the muscles are weak in the shoulders for you. What happens is the shoulder muscles are like this. When the muscles are weak, this goes like this. The shoulder blade goes like this. And the cuff muscle weak, therefore it comes up like this. When the space is narrow, when you lift it up, it causes pain for you. What we suggest them is do the exercises after the physiotherapy, like strengthening the scapular muscles, pull the shoulder blade up. Strengthening the cuff muscle, pull the shoulder down. If you see here, the bursa is actually, it is normal here like this. When this muscle is weak, the space is narrow here. We ask them to strengthen this muscle. Okay. It's usually that happens in the overhead activities, or it can happen with the heavy lifting as well. Can happen sometimes. When the bursa is thickened, then you get the inflammation. When therefore you get a mid-arc pain, especially they have mid-arc pain. And when they're doing the Hawkins test, the movements like this causes the pain in the shoulder further. It's more common in the badminton players as well as the swimmers. If you do the exercise and do it, it won't come. Actually, if you do the exercises to strengthen the muscles, it won't come. We do a X-ray and the non-resistant cases just to see the acromion. If you see the acromion here is like a hooked acromion. The acromion varies from like a normal flat acromion to curved and then hooked. If this is the case, then the might need surgery. These are very rare cases, but that might need surgery. They may have a very severe pain in the shoulder with impingement, because this may lead to cuff tears in future if you don't treat it. That if you're not having adequate exercise, then it may to cuff tear. Main treatment for the impingement is physiotherapy. Once it's strengthened, that once the physio has done the treatment with relieving the pain, they ask them to strengthen the scapular muscles. That will strengthen, that elevate the shoulder blade. Strengthening cuff muscle, pull the shoulder down. Once the space increases, automatically pain will go off. Then it won't come back again as well. Therefore, we ask them to give physio and then exercises to strengthen the shoulder muscles. This is exercise. We got a video on the YouTube as well. Like this is the shoulder stretches. This is anti-capsular stretch, this is posterior anti-capsular stretch and trapezial stretch. This is the strengthening the cuff muscles. This one is supraspinatus, external rotator, internal rotators. And this is the strengthening the scapular muscles. If you strengthen the scapular muscle and cuff muscles, actually it will actually prevent the impingement to come back. In the resistant cases which not settled with the physio, they can't do exercise with the pain. We give them an injection, subacromial injection, which will relieve the pain for them. After that, they can do exercises. In very resistant cases in which see the hook acromion, then we actually go and shave with the arthroscopic surgery. To shave this is very rare surgery nowadays, because once this, if you do exercises, you will relieve the pain. Therefore, you don't need to do anything. Mostly, if you do the scapular cuff exercises, you don't need any surgery for them. Next one is a frozen shoulder. When having the, it's like middle-aged elderly patients have like a frozen shoulder happen. The exact reason is we don't know, but they can get a pain and stiffness. For the period of time, slowly the pain starts and stiffness will get in. And it's most common in the patients with diabetic, but non-diabetic patients also can get it. How to differentiate this from the frozen shoulder is mainly we tell them the movement will be restricted in this, mainly especially the external rotation. We ask the patient to do external rotation of the shoulder. If they're having less than 50% compared to the normal side, that means it's a frozen shoulder. That's the main examination we tell them. Frozen shoulder, how to differentiate from the impingement. Frozen shoulder is a self-limiting condition, which usually settles with the physiotherapy, mainly the wax bath first. Like if you do the wax bath, you strengthen the wax bath and mobilization exercises, which will improve the shoulder movements. 80% of people improve with this one. And along with the wax bath, I'll tell them to the exercise at home itself, in which they can do the front and side elevation with the wall walking and the external rotation, and then this is for internal rotation. These exercises, they ask them to do it every 3 hours, 2 hours with the help of a hot water bag. Hot water bag before and after exercise, that will prevent the pain for them, and then they can do the exercise that will increase the movements for them. In the cases resistant to the physiotherapy, then we can give an injection to them, because we need to look at other causes of shoulder pain like a cuff tears. By doing the examination, like a cuff strength and things, we know that there's not a cuff tear, then we will proceed with the physiotherapy for them. In resistant cases, we may do MRI scan and then we can give an injection for them, intra-articular steroid injection, because the PRPs and gel injection won't work much for frozen shoulder. Mainly the steroid injection works. I do a special technique called hydrodilatation, which we under ultrasound guide, we inject the water along with local anesthetic and steroid, which dilate the capsule all around. Therefore, the movements will improve very much, and as well as they do exercise regularly, it will relieve the symptoms immediately for them. The tenosynovitis, the pain in the wrist, is like if they're having pain in the wrist when they're moving the thumb, we ask them to wear the splint, and ultrasound massage physiotherapy will improve the symptoms for them. Tennis elbow. Tennis elbow is like many people have probably the tennis elbow in the elbow. How many people had elbow pain before in their lifetime? It's okay, like some hands, about 10% of people had this in the hall, but it's a very common problem. Like when you had just knocked or something or lifted heavy weight, you can start to have elbow pain, especially when you're lifting the weight. This position, if you lift a weight, you're having pain, that means it's a tennis elbow. Having pain when lifting on the other side, that's a golfer's elbow. You have pain on the inside, that's a golfer's elbow. Pain on the outside is a tennis elbow. This usually settles with a physiotherapy. and vitamin D and B12s. And if it is a main thing to do this stretching exercises, if you want to prevent it. If you're having some elbow pain, once the pain is settled, if you do the exercise and do the work, then you can prevent the tennis elbow problem. The golfer's elbow as well stretch the flexor muscles. Resistant cases, we give them an injection if needed, but most of them settle with the physiotherapy, especially ultrasound massage and stretching exercises. Back pain. This is the most common problem, and it's as we seen the neck pain, back problem. How many had a back pain before? Okay, it's almost like about 70% of people lifted hand. How many of you had any of your family members or yourself had a back problem? It's probably almost everybody probably had some, because 90% of people in their lifetime experience some back pain. Next is the common is a shoulder pain. Shoulder pain, 70% of people in their lifetime experience some shoulder pain. The back pain on its own will settle with the physiotherapy. But what are the stages you need to investigate further? For having back pain without leg pain, and if you're having leg pain or a urine or a bowel problem like incontinence problems or a numbness or weakness, loss of weight or appetite, fever means that maybe due to the infection, you need to see the doctor, and then you need to take an MRI scan may be necessary for them before the treatment. If you're having isolated back pain, it might settle with the physiotherapy, but you need to do the mainly prevention, like you need to do the exercises. I'll show the exercise for a back. Your posture should be corrected. Use the correct technique when you're shifting the patient or shifting the weight as well, and what adequate hydration and exercises. This is a stretching one, stretching for the back problems, and this is the strengthening one. If you're having back pain, if you do this exercise regularly, you can prevent it coming back. This will strengthen the back muscles here. If you hold it for 10 seconds, 5 times a day, you can prevent the back pain coming back to you. It's like mainly this is called bridging. Those people using the yoga, they might know this problem, like these exercises when they do that one regularly. And this is stretching strength. If you do this once regularly, then you can prevent the back pain in your life. We tell them at the time of back pain, we ask them not to lift weight and bending, avoid bending at the time when they're having back pain. Use the correct bending rather than that when seen in the picture. What's the correct technique of bending rather than the bending the back, bend the hips and knees. Okay. Next problem is like the most common problem now in elderly people is most of them having a knee pain, like a knee arthritis. Young age, you probably not have much problem in the knee, but people come to me saying that how can I prevent it? Okay, most people when they're having younger age, if you do the exercise, you can delay or prevent the arthritis in future. Like mainly it's to strengthen the quads muscle. I show the exercises to you. This is mainly to strengthen the muscles of your each joint. You can prevent the joint load goes through the joint line. Therefore, you can prevent some wear and tear in the joint. Therefore, you do the exercises regularly. That one. It's a wear and tear in the knee is called knee arthritis, and it's mainly to keep the bone like a bone strong as well. Do the quads exercise, and it goes from grade 1 to grade 4. Like a grade 4, the permanent solution is a knee replacement, because wear and tear we can't cure it, but we can have other treatments options available to give a temporary relief of pain. Temporary means it may be 1 week to many years as well. People having that like arthritis, they get down with the physiotherapy that might improve the symptoms for them temporarily, or have a lot of food supplements there, a lot of injections like a steroid, PRP, Seneca, stem cells, Hyalase injections. All of these will improve the symptoms for them sometime. Like say some patient have relief for 1 week, some patient have for years. It varies with the patient to patient. Sometimes there's a brace, special brace is available if they're having like a grade 3 or 4 arthritis as well. If they don't want surgery, we suggest them the brace. This one actually opens up the joint slightly. When they wear this when they're walking, they can actually prevent the knee pain. So many people, young people like in 40s and 50s come to me with the knee arthritis. We tell them the knee replacement because that's a permanent solution for them. But because they are young, the knee replacement come for about 20 years, like 15 to 20 years it will come. If they're 40, then they might need a revision knee replacement at the age of like a 60. We tell them they can just, if you're having better with this type of like a braces, you can use this for some time. It improve their quality of life. They can go for walking with it, they do all the activities with these braces. It will actually prevent it to having a knee replacement for some time. If they are like older, like a 65, 70 years old, they can still use it as well. Some people don't want surgery. We tell them, okay, these are the options available. Choose which one you want to choose. Like this is exercise. We tell them like a simple exercise, just to lift when you're sitting, just lift the leg up, hold it for 10 seconds, 20 times, morning and evening. If you do this regularly, if you do the quads as well, that's fine. Quads exercise in your exercise program, it's fine. Strengthen the quads muscle. We tell the quads is the main muscle for the knee. If you strengthen this muscle, actually you can joint force goes through the knee is very less for them. Especially the front of the knee, you get a 10 times of body weight goes there. If you're having a body weight of about 100 kilos, you get about 1000 kilos goes there in the knee. If you reduce the weight to around like a 10 kilos, then about 100 kilo weight comes down in the knee. Therefore, the strain in the knee goes down if you reduce your weight as well. Another common problem in younger people, like how many people had a knee pain before? The younger people, like if you're having like a knee pain in the when you're going staircases, like people having pain when they go staircase, like sitting to standing position, they get the pain in the knee, especially in the front of the knee. That is mainly, this is a very common problem as well. Like the kneecap is normally like this in the groove. If it is tilted slightly like this, it can cause the pain for you here, especially when you load and then go upstairs or downstairs or bend the knee. Loading and bending with this tilt, then it can cause problem. Mainly it is due to this muscle is weak for them. If you strengthen this muscle, then pull the kneecap towards like this towards the center, then the pain will go off immediately. The clinic itself, patient have better pain relief with this one. That we ask them to lift the leg up, turn it outside. Therefore, your medial muscles of the knee is strengthened like a vastus medialis obliquus muscle, VMO exercise. Medial muscle, if you strengthen this muscle, that will pull the kneecap towards center, that will relieve the pain for you. This is a very common problem in many young people. I've seen that like a lot of people, IT people as well, especially those who gained weight recently, they have a lot of this problem because of the 10%, like 10 times of body weight goes there, they get the knee pain. If you do the exercise, it will settle down immediately. Or those doing gym activities or regular aerobic as well, they get sometimes pain in the front of the knee. You're doing it, if you do the exercise, this exercise, and carry on with your normal thing, it won't be painful to you. Especially in the front of the knee. Anterolateral aspect, like a front and the lateral aspect of the knee, it causes some pain. Heel pain. Like how many had the pain in the morning when you get up in the morning, like, or when you rest it, when you walk, you have a heel pain in the foot. Okay, it's a very common problem as well. It's a they get when they get up and they walk, they have the pain in the heel. This is a plant called plantar fasciitis. Main thing is the calf muscle is tight for them. Main problem this happens due to the calf muscle is very tight. If you stretch this calf muscle, this pain will go off. Okay, it's that's a very simple thing. Like if you, because your calf muscle continues as a plantar fascia down in the foot. When you stretch the calf muscle, you can prevent the pain coming back. It will actually cure the problem immediately for you. If you're having too much problem, you can have like a physiotherapy, like ultrasound massage, and you can do the exercise. And you can just lean the body, and then with this one, like don't bend the knee as well. If you don't bend it, bend this knee, that will stretch the calf muscle for you. Hold it for 10 seconds, 10 times a day, morning and evening, it will cure the problem for you. To prevent it coming back, same exercise you can do, less frequency is fine. If it still not settles, then go and see the doctor, might give some injection to you. But that's very rare thing. Most of them will settle with the simple stretches is fine. Ankle sprains, it's like, this is a common injuries and many people have when they walk, they just twist the ankle. That's a lateral ligament injury, ligament here is the injury. Most of things don't need any treatment. Like mainly you need to avoid inversion. That same type of thing, you need to avoid it. Use a crib bandage if you want, that give mental support. And just avoid the inversion for 6 weeks. And Samanangal Potokal, don't sit cross-legged. That also causes inversion of the foot for 6 weeks. And no sports until it heals. Because what happens is when you keep on doing this action, the ligament will heal, but heal in a stretched position. That can cause instability in future. Therefore, we tell them to not to do this action, and 6 weeks time it will heal. It ranges from 2 weeks to 6 weeks, depends upon the grade of injury. If a grade 1 injury is a minimum strain, then it will settle in 2 weeks. If it's have a major problem like grade 3 injury, don't need any surgery or anything. But mainly you need to do the just resting, avoid inversion, it will check it for you. If you're having any bony pain, then they may do an X-ray to rule out any fracture. If there's no fracture, then just carry on with this treatment is fine. After 6 weeks, you need to strengthen the muscles around the ankle by doing the wobble board exercise. Then you won't get instability in future. Okay, it's any questions, anything so far? Okay, and just coming to the preventive, like many of the the people come with their parents with arthritis, they will ask them how to prevent it. Okay, I tell them to strengthen the muscles. Each joint have a specific muscle. Their neck muscles, back muscles, knee, quads, hips, gluteal muscles, and shoulders. We say scapular and cuff muscles. Elbows, biceps, tricep. If you strengthen these muscles, that will actually prevent the load going through the joint. Therefore, you lessen the arthritis process. You can delay the arthritis process for you. Therefore, strengthen those muscles that will actually prevent the arthritis. And drink adequate water. That hydration. There's a website, Preventive Orthopedics. It's just I mentioned about all the exercise in there as well. It's excuse me. Coming to the vitamin D and B12, it's those who have this all the pains like muscular pain. Some of them might be due to the vitamin D or B12 deficiency, because in the hall, if you've not taken any supplements in the hall, like I say, 90% of people, if you're not taken supplements in the last 2 years, you have probably the 90% of have a vitamin D deficiency. If you take a test, it will be less than normal. And also vitamin B12, about 50 to 60% of people have vitamin B12 deficiency. I think a lot of us not got the intrinsic factor, which is essential absorption of B12. Therefore, if you take a supplements as well of B12, sometimes it won't be absorbed very well. Therefore, those patients need say injections, like a B12 injections might be essential. Those having tingling symptoms in the legs, tiredness and muscle pains, those settle with the vitamin D and B12 supplements. Initially, when I came from UK, I usually test for all the patients, but realized that 90% of people have vitamin D. Now, if they not had any supplements in the last 1 to 2 years, then I give a supplements for them. I give a 6 weeks course for them. 6 weeks vitamin D weekly once, and I'll give the vitamin D along with calcium. I'll give it. B12 as well. I give because sometimes the people have a non-specific pain, like MRI it might be normal. They've taken all the physio and everything still normal. That may be due to vitamin B12 deficiency as well. They had a B12. One of the patients, he had a shoulder pain, he had a surgery and everything, he came to me. And I not tested B12 for them. I just given an injection because vitamin B12 is a water soluble. I give an injection for them because excess comes out in the urine. If I given the vitamin D, its pain is settled. I've seen some patients having non-specific knee pain unsettled with the B12 as well. Therefore, vitamin B12 is one of the common problem as well. D, you can take a supplements like sachets or a thing weekly once. B12 injection might be better for them if you're not settled with the symptoms. Okay, the take-home message is like use a correct technique and do the preventive exercises, adequate water, and get it treated if you get the pain. Like don't ignore it if you're having problems, because don't ignore your symptoms, you get the problems. Okay, any questions or anything? It's a
Thank you, doctor. It was very useful one. I think many a time when we go to the doctor, they'll say, you have the backache because you're doing sedentary job. But whenever I ask you what you mean by sedentary job, how will you define in number of hours? How exactly the sedentary job is being defined? That means when we say in I, we always say 20-20 rule, 20-20-20 rule. Is there any specific rule for those when you define sedentary, and what's the solution for it?
I mean, I don't know the correct definition for sedentary job, but we tell them to just get up and stretch yourself. How many people in the survey have seen the walking? Most people do the walking as a common one. It's walking as well into the brisk walking is better. Like how is like a minimum like a 5 kilometers per hour. We'll say if you're walking for 1 or 2 kilometers per hour, that's not like a brisk walking. You won't get adequate exercise benefit. And you need to walk about 5 kilometers in 1 hour is better. That's what we're doing sedentary job. We need to make sure that you compensate with the other exercises is better.
No, doctor, I'm asking is while on work, many of them will sit and do work for a longer time. Is there any suggestion that during work time, very often you have to take off?
You mean
means you have to get up and do?
Get up, yeah. We say that about every hour, if possible, every hour you can get up, go around, drink water, come back, stretch your muscles. I'll say for IT people that because they work for about 8 to 10 hours a day, I'll ask them to just get up at least like once in an hour if possible. If not, then at least minimum once in 2 hours get up, go and stretch and come back.
What is the solution for example, I've seen our optometrists, they continuously work, especially ophthalmologists. They have to sit in their room most of the time. At least optometrists had an opportunity to go and call the patients. Ophthalmologists they don't do because patients keep coming. Maybe if at all, I understand ophthalmology to me. they will be sitting and slit lamp. Uh, they go to two or three things. That is more than enough for an ophthalmologist, because very often I've seen ophthalmologists who are doing a lot of surgery, they do tend to have a lot of neck pain. And I think especially for them, do you have any solution on
Yes,
behalf
yes.
of Dr. MB?
Yeah, especially if you're doing the work with a bent neck, because you bend too much to do the surgeries, isn't it? Then better thing is you can like a possible to elevate it up, or mainly exercises to prevent it. Neck exercise is the best thing. Other thing is, like as you're saying, that when you're sitting, that my friend used to go to call the patient come out. It's like go out to get the patient come out. Therefore, at least you go to the different rooms. That's the other thing. You can just get the two rooms and go to the different room and come back. At the workplace, it's difficult. It's our hazard, like it's occupational hazard for us. It's a thing, but you need to do the as active as possible. That's when you can do it. It's a
Thank you.
thank you.
So most of us are sitting inside the room. Like we come inside by 8 o'clock and then go by 6 o'clock. So we don't even get the exposure from sun. So what other things which we could actually do it during our work time so that we get some exposures and so that all of us can get benefited out of it.
Sun exposure, I'm not sure how you can get it when you're inside the work, but main thing you can take some supplements, especially the vitamin D supplements. And also, if you give the option of going out as well sunlight during work hours as well, is difficult for us to go in when the sunlight. It's like a but go for a regular walking in the morning or evening and exposed to sunlight is better. If you not have a time, then probably don't know how to, because your workplace and things you can have a on the afternoons or something you can go and see it.
When we have a knee pain,
Yes, if it is tolerable pain, you can walk, no problem at all. If you're having too much pain, especially if it increases the walking, then consult your doctor. Make sure that you can have like a braces. If you're having arthritis, have braces and then walk. Those things will be better. But if you don't walk, your weight will increase. Then what happens if you don't exercise? It will actually, it's like a vicious circle. It will get more arthritis, more problems.
but walking is not difficult. Yeah, sitting down and getting up is only the difficult thing we have.
Then
At
walking
the
is
time,
better.
walking we
Yeah.
can do it.
Walking you can do, no problem at all. We suggest for the patients who are having arthritis, suggest not to sit on the floor and get up, or not to sit on the Indian toilets. The reason is mainly pain. If they tolerate the pain, they can do everything they want.
Thank you.
Doctor, excellently covered all the issues that we have, because as here Dr. Krishna Kumar said, we are putting ourselves into hazards with every examination that we do. We are typing on the computer, then we go and sit on the slit lamp. We have a bad posture. We don't sit straight. We sit
Yes,
on the
yes.
side and see the patient, and then we go and put on our, the indirect ophthalmoscope and then look at with your neck down. So this is the routine. So we are putting every part of our body to strain. So most of the things you have told, but what about like in computer usage, or say for example, even when we are looking at the instruments, there are certain contraptions that come, like putting a back brace, like forcing you to have a proper posture. Would you recommend it as a routine? Because we, as you can see, that after 1 hour your posture becomes like that, vulture neck. So can we use those contraptions regularly? Do you recommend that to force yourself into a proper posture? Will it help?
There some people use that strap like thing, like a figure of eight, wants to get the straight posture and things. We can use it, no harm in that one. The people, as I ask them to use it, but as we like speak like this one, like when you're starting the job, you're okay. Just straight away, you just, well, as the time progresses, you actually then go into the posture of more awkward postures, will go for it. But for the ophthalmologist, as you're saying that the posture is a problem, one thing is exercise, neck exercise. If you do it, then you can prevent the pain coming back. But you can use that, whatever the equipments available to correct the posture, you can use that one as well. I've seen that many IT people are using that posture as that. They're having much benefit with that one as well.
Really nice talk, doctor. You know, these veg pillows are available for the neck pain. That in Amazon you get a lot of advertisement for something called veg pillows for your
Yes,
neck. So, but sometimes if you use it also, sometimes the pain aggravates. So, how do you select? For example, you're talking about the posture corrector also, and there are a lot of these tools available in the internet, and sometimes people go for the cheaper ones. How do you know which one is the right neck support or the back support, and what kind of this belts that you get for the posture is good? Because sometimes these wedge pillows actually seems to aggravate the pain, and there are many kinds. And then for the lower back you have something called the donut pillow, and then the tailbone pillow. So there are so many options available. How do you know which one to select?
No, the neck, mainly the purpose of neck pillow is actually give some support to that area that where you're having a depression in the neck on the side. That also not work for many people. Some people feels it better, but I'll ask them to just if you're having a person lying on your back like this, they ask them not to use much pillow there, because that will, if you put a pillow, then it will put more strain in the neck for you. If the person who mostly sit on the side, right side or left side, lie down, then we ask them to use, that wedge pillow is much better for them. That because they give support here as well as that support for the neck as well be better. Because otherwise your neck will go like this. For user, wedge pillow will be better for the person who lying on the sides mostly. For this who lying on the back, better user thin pillow is better for them. Regarding the donut pillow, only having coccydynia, the tailbone pain, those people only need to use the donut pillow. Otherwise, not necessary. Back support and chairs and things with the back support, you can use any support which actually supports your back. Because the quality might differ, but its purpose is actually mainly support your lumbar lordosis. That is a normal posture that you're supporting that lumbar lordosis. As long as you're having quality product, that's fine. You can buy those ones, fine.
Sometimes they also say it's better to lie down flat without anything.
Yeah, that's fine. That's what I say.
Does that help better, or having like these pillows help better?
No.
Pain.
Pain wise, most of our neck pain patients, I tell them not to use pillows, like a very thin pillow or not to use a pillow is better.
Good evening, sir. So, how often the breaks are required for optometrists? Like, as I'm an optometrist, how often we can take the breaks? Like,
break?
Yeah.
Minimum, every 2 hours, you can go for 5-minute break.
For 3 hours.
Sorry, it's how many hours do you work? It's 8 hours.
8 to 5.
That means that you having a major break will be there, lunch break will be there. That is different. This is when you're having work on things, you can take a 5 minutes break, at least 2 minutes break. If you take every 2 hours, will be better for you.
So we have for computer users for 20-20-20 rule. So we have such rules for any with respect to our job.
Sorry, where are you, sir? I can't. Okay, that's fine. Okay, that's fine.
With respect to our jobs.
20-20-20. What is it? It's
that is a rule for computer users where they have to take if they are using computer for more than 1 hour, we will tell them to take for every 20 minutes 20 seconds they have to see 20 feet far, so their eyes will get relaxed. So regarding the same,
that is for eye strain.
Yeah,
that
for
is
eye
fine.
strain.
Okay, eye strain is fine. I'm talking about musculoskeletal wise.
So, yes, for same like that, we have any
we suggest a 40 minutes to 50 minutes take a break, like a mini breaks.
Mini breaks.
Like mini breaks for just if you're sitting in the computer constantly, like 8 hours and things, we say them 50 minutes something. I'll say every hour you can take a break, it's fine, but it may not be possible. That's what I tell them. At least every 2 hours take a break. That means 1 or 2 minutes is fine. Take a break and then stretch your muscles, walk around and come back.
Thank you, sir.
Thank you.
Hello, sir. Very nice presentation. I have a question regarding vitamin B12. You said 90% of us are vitamin B12 deficient.
B12 is about 50 to 60%.
50 to 60%.
Vitamin D is very common. Yeah.
So you said injections are the best option, right?
For the B12 injections are, because we don't know which ones, which of us got an intrinsic deficiency, intrinsic factor. Therefore, I give injections for most of the people if they tolerate it.
Achha. So I see some colleagues or some friends, like they take over the counter vitamin B, calcium and B12, everything is taken over the counter without any physician's consultation. Do you recommend that? Is that okay with everyone being deficient?
Yeah, it's if they taking 60,000 units vitamin D, I'll tell them not to take more than 6 to 8 in a year. I won't suggest them to take more than that one. Same as injections as well. B12, it's okay. You can take monthly once if you want. They have deficient people, they take monthly once sometimes. But for the vitamin D people, I tell them not more than 6 in a year. That's what I tell them. You're taking every 2 years, maximum 12 in a 2 years time. That's what I'd say.
Thank you. I have a second question also regarding kids. So the kids these days also doesn't get much exposure to sun, as Rashma asked. So they are full time in school or at home playing, seeing screens and playing in indoor games. So will the deficiency come much early in kids? Like what kind of precautions to be taken?
Like as you're saying, the outdoor games are slightly better for them. Like when you encourage them to play in sunlight and things for the kids, and you can give some multivitamin syrups for them because it's difficult to test the like vitamin D for the blood test and things for the kids. We'll just give them for our kids. We'll give them like 2 months in a year or something. Just give multivitamin syrups or something. It's fine. Yeah, it's
Right. But sending them out is difficult these days.
splint. It's you mean
So how do you balance the when we splint automatically the muscles relax because the splint is going to take the brunt of the
yes, we
support.
suggest splint for some conditions like those who having like carpal tunnels, Dequerens disease, having the thumb problems. If you're having any injury, we give a splint to them to rest that muscle. But on its own, like for a back problem, we having like those people having like a back problem might not settle with the normal thing. We give them a belt, like a LS belt, will give them. But that to reduce the mainly those having like a big tummy, it might be effective for them because it reduces that
Pull.
core muscle pull. Therefore, that may be better. But normal, we don't give splint for the normal conditions. It's unless they're having specific problem like injuries, we give a splint to them that muscle. I don't know what you mean by exact sprinting.
No,
for
like if
someone.
you have this and
Oh, that
do
one.
this,
Oh,
this.
yeah. It's,
So that way knee splint if you give and you use the knee splint and walk.
no, that is
And carpal tunnel if you're using your splint
yes, yeah.
and your repetitive work continues. You can't change your job. So
yeah,
does
that-
it have a cutoff
Yes, yes,
like
it's,
beyond which point you stop all the splints? Or you can continue to insult yourself with the splint on and
No, it's like say for example, if you're having carpal tunnel, if it is settles with wearing a splint, normally it is like a carpal tunnel might be due to the hypothyroid problem which is not being treated. If you treat that one, that might settle down. You can't use a splint for lifelong, isn't it? If it's not settling after 6 weeks, you need to see. But for the knee arthritis, which is a non-treatable, non-curable condition, then you can use a splint for lifelong if you want. Like those problems, there won't be any problem because using the splint when you're mainly walking, you're not using all the time in the night time and things. Therefore, you can use the splint when you're walking, then that will prevent the pain for you when you're walking. For a thumb as well, the same thing. Dequerens disease, use the splint until like a 6 weeks maximum you can try. If it is still not settles, then you can go and see a doctor, then suggest what the treatment options are available.
okay, thank you.
Thank you very much. Thank you. It's,
Thank you, sir. Now, may I request Dr. Girish Shivra, President, Medical Research Foundation, to honor our chief guest, speaker. May I also request Dr. Mani Bhaskaran, Dr. Rani George, sir, Dr. Rashima, and Dr. Krishna Kumar, sir, to join them. Thank you, Dr. Shivaraman, for the insightful session and introducing us to the preventive orthopedics. And thank you, audience, for making this session interactive one for your patient listening. And thank you, Multimedia, for making all the arrangements. And thank you, Housekeeping, for all the arrangements as well. So, meet you all in the session soon. Till then, thank you.